Good afternoon, Ian.
Nice to have you with us again. Is that your experience, those figures? Does that bear out what you're seeing?
Yes, I think so. I would say it varies a little bit from day to day and week to week, precisely how many patients are unvaccinated versus those who are vaccinated ending up in ICU. And we've got to remember that because vaccine rates are now really quite high, you will end up with vaccinated patients in ICU.
Yeah.
But certainly amongst the most severely unwell patients, I would say that almost all of them are unvaccinated. And of course, they tend to be, on the whole, younger patients because of the way the vaccines have been rolled out.
Yeah, of course.
And on average, younger patients don't get so sick with COVID. But these patients who are coming in who need intensive care really are very unwell. And to my mind, this is, if not fully preventable, then at least, largely preventable.
Are they patients? Sorry to interject, Andrew. I was just going to say, because a lot of our callers are intrigued by this. It's only by having these kind of conversations, of course, that we're able to dispel some of the myths that are out there, which I'm sure is frustrating for your profession as well. It's probably best never to glance at social media when you do what you do. I thought what I do for a living, it's best not to glance at social media, but in your world with this particular subject, I would imagine that's quite challenging sometimes. And many people are commenting and say, well, are these mostly people with underlying health conditions, people who are very obese, for example?
So interestingly not. I would say that most of the patients we've had in the sort of the third to fourth wave who've not been vaccinated are young people who are otherwise pretty fit and healthy. Maybe they've got a little bit of asthma or they have well-controlled diabetes and so forth. And I think the problem is that the term underlying health conditions is often used. People sort of think, well, these patients were already, nearly at death's door anyway, and COVID was just the last thing. When we talk about it, really, we're talking about very mild conditions that people will live a full and normal life with if something else doesn't come along. And there are still plenty of people who have no medical diagnosis at all who are getting very sick with this.
So is that just the lottery, sorry to sound crass, of how COVID will affect some people?
Yes, I mean, you're right. There's a degree of, it's not random because there's a degree of genetic susceptibility, but obviously you have no control over your genetics.
Yeah.
And we know that from all infectious diseases, that your genetic predisposition is the strongest predictor of whether you're going to do very badly with an infection or not. But even in those who have a genetic predisposition towards severe disease, the vaccines are effective. So
when you look at patients who are in ICU, those that are very sick, is it a complete no-brainer as far as you're concerned that the correlation between those being very sick and unvaccinated is unarguable?
Absolutely. I mean, I think if we look back, what we need to do is look at the levels of cases we've got in the community at the moment, which are very high. And if we look back to January this year, where we had similar levels of cases, and yet we look at what's going on in intensive care units at the moment, it's like chalk and cheese. So in January, we were expanded out into surge capacity units using, hastily redeployed staff from all around the hospital, scrabbling to get ventilators together. Now, yes, COVID is putting significant pressure on us, but we're nowhere near that, despite having very similar levels of community cases. And the only difference is vaccination. So it is very clear to my mind that the vaccination is, and the data backs this up, that the vaccination is preventing severe disease in a large proportion of those who get infected.
Are there dissenters in your world on this one, Andrew, that don't believe that analysis, that think there's something else going on?
Yeah, so, I mean, there are a minority of people who purport to be scientists and are, trained doctors and so forth, who argue that the vaccines are not as effective as the data would say. But they are a tiny, tiny minority of people, and they're certainly not representative of, a general view in the medical profession or amongst scientists.
Yeah.
And I think even actually in the general public, to be honest, the anti-vaccine view has been overblown. It's a small minority of people who are heard quite loudly. But I don't think actually, and I think we can see that because we can see how widely the vaccines have been taken up. And, we're now at about 85% of the adult population fully vaccinated. So clearly the vast majority of people have taken the message on board. And there's a small group who are making a lot of noise, and I think, unfortunately, are colouring the opinions of some people who are sitting there thinking, should I get vaccinated or not? And they go, well, it sounds like there's a debate here, when in fact, it's a bit like climate change. Yeah. There's no debate about climate change. It's happening. We just have to get on and deal with it.
But I guess some people, Andrew, will look at those figures, the yellow card reporting system, for example. They'll see that. They'll see a figure like 1,700 people who've died, not necessarily because of the vaccine, but after having the vaccine within a fairly short period of time. And understandably, patients will look at that and say, well, hang on, that looks like that I am being asked to take a risk here.
So I think it's very, very important to understand how the yellow card vaccine or the yellow card drug adverse event system works. So that allows anybody, be that a healthcare professional or a member of the public, to report an adverse event that is associated with having taken any medicine. And obviously the vast majority of those are completely coincidental. You know, bad things happen to people all the time. You get vaccinated and the next day you get run over by a bus. That's a bad thing, but it's clearly not related. But, you know, so these sorts of reactions will get reported, but most of them have absolutely nothing to do with the vaccine. When we look in detail at adverse events from vaccines, we obviously had the clotting events with the AstraZeneca vaccine. That's extremely rare, but we could see that, and it became very clear very quickly that this was a problem, albeit in a tiny, tiny minority of people. And indeed, scientists have now worked out, you know, at least some of the mechanisms behind that. So I think what we can say is the rate of adverse events from vaccines is very, very small. Clearly, if you have a devastating effect from a vaccine, that is an individual tragedy. But we have to put it in perspective of the risk of severe disease from what we're trying to prevent. And that is really clear that your risk from COVID is many orders of magnitude higher than your risk from vaccination. So I cannot tell you that vaccination is 100% safe because it clearly, like all drugs, has a small risk of adverse events.
And that would be the same for the influenza jab as well, I would imagine.
It would be the same for any vaccine. All vaccines have a tiny minority of cases where people will have an adverse reaction to them. The vast majority of those adverse reactions are self-limiting and not serious, and a very, very small proportion of people will unfortunately suffer harm from it. And that's why, you know, the government has a compensation system in place for vaccine-associated harm, because we know it happens. It's just very, very rare. But the diseases we're preventing with vaccination are very, very serious, and in COVID, extremely serious.
And I understand that the issue, as you see it and others in your profession see it, is kind of twofold, really. So you have COVID patients who you believe are dying unnecessarily, that they could have reduced or eradicated that statistic if they'd been vaccinated, but also during the treatment, and that treatment can be elongated. I understand that a COVID patient will spend longer in ICU than maybe, you know, a transplant patient or a cancer patient post-op, etc. So as a result of that, there's a sort of a bed blocking scenario going on as well.
Yes, and you know, that's the same for anything that brings you to an intensive care unit. And I do think we have to be a little bit careful about victim blaming here, you know, because we could say exactly the same about people who drink to excess and end up with liver disease, or go rock climbing and fall off a cliff. You know, all of these things can land you in intensive care. And if you're in intensive care, that's a resource that somebody else can't use. But in this particular situation, it is the case that this is entirely preventable by an extremely safe and effective vaccine, for which the vast majority of arguments against the use of are complete baloney. And so I think that's probably where the anger comes from. And we've got to be careful not to direct it towards the individual patient who's in front of us, because, you know, they arrive in that situation for all sorts of reasons. But as a general population level, yes, it is frustrating to see people being admitted to an intensive care unit, consuming a precious resource that was entirely preventable.